What do we want? When do we want it? What do we want? When do we want it? What do we want? When do we want it?
I'm Catherine Leiberg, and I'm the president of AFSCME Local 3299, and we're out here today along with our supporters, and that's students on the campuses, nurses, UPD, and of course thousands of our members across the state. What we're fighting for is just the right to speak up at work. We got harassed and intimidated back in May when we stood up for patient care. It's a serious issue, it's a fundamental issue here at UC, and we're not going to shut up about it. We've got to be out here.
Well, so are you saying this bullying, why don't you talk about the bullying that's been going on statewide and how it's affected your members?
Yeah, absolutely. Number one, it's disgusting that that's UC's reaction to us when we, the frontline care workers who know more than anyone what's actually going on in these hospitals, when we speak up for patient care. But what they did was systematically across the state poll our members, corner our members, and ask them, are they going on strike or not? That's intimidation. They have no right to ask it nor any need to do so. Worse than that, they threaten members with discipline or possible firing. Patently illegal. And all meant to squash the real issue, which is their need to address safe staffing. We filed a charge with the Public Employment Relations Board, and they don't have to issue a complaint for every charge they get. They found substantial evidence to warrant issuing a complaint against the university. There will be a hearing in March. So while the university says there have been no findings yet, it's significant that PERB has found cause to issue a complaint.
Have you gone after these managers individually who are doing this? I mean, like a face, this is who's bullying the workers, that kind of thing?
Frankly, that's what we'd like to see Janet Napolitano direct her staff to do. We want accountability on that level. They broke the law. Why are they still working here without discipline? I will say that it has strengthened and galvanized our members if we've decided we have no choice but to stand up. So in the workplaces now, in having to defend our rights, I think that we will end up stronger.
And the University of California, San Francisco Medical Center is making a lot of money. I mean, is this a money issue?
It's a money issue for the university. They're clear about that. They'd rather talk about money when we'd rather talk about patient care. So let's talk about money, about the fact that the CEO here got a $300,000 bonus after he eliminated 300 jobs. Now tell me, where's the safety in that? We want to talk about safe staffing.
And are you going to be fighting for the same things that the nurses want in their contract?
Yes, we will. That and more. That's one reason why we don't have a contract yet. We're fighting for the kind of safe staffing that nurses already have protection for by law. We don't have a law to protect us. We need it in our contract.
Tim Thrush, I'm a diagnostic sonographer at UCSF, and incredibly, as a patient care worker and an advocate for safe staffing and a safe environment for the patients and students, I was actually one of the ones that management targeted. I was lured into a supply room, and my manager followed me into the supply room and very aggressively interrogated me after trapping me in the supply room about my participation in the May strike and about informing my coworkers of what their legal rights are when management was interrogating and intimidating them as well. And it's pretty shameful that, you know, as we're advocating for patient safety and student safety, that UC management coordinated a statewide campaign against us.
Isn't that illegal?
It's very much illegal, and we filed charges, and that's what brought about this ULP strike. PERB, the California governing body for public employee unions, agreed with us, and they issued a complaint, and the complaint will go to trial next March.
And Napolitano, what's your stand on this?
Well, I have to say Napolitano is actually a little more friendly than UDOF and is doing a much better job at trying to open the doors of communication with the unions and the workers. I hope that, you know, she continues with this and she changes the management culture at UC that wants to dampen our voices, because we're going to be heard and UC is going to listen one way or another.
Now, they made a settlement with the CNA. Are you asking for the same settlement the CNA got?
We're asking for similar things. We have more on the table. The nurses actually don't really have to fight for safe staffing because they have a state law mandated nurse to patient ratio that helps them with some of that. So we have to fight for our right to advocate for patient safety.
And what are your demands around health and safety or patient safety?
It's a multifaceted situation with making sure people are properly trained, staffing, so that the staff knows all of the routine around UC, and they stop using contracted workers that aren't beholden to the university, and committing to a work standard and workflow that can be maintained in a healthy way.
Is there much outsourcing going on at UC?
There's lots of outsourcing at UC. In the patient care titles, they abuse the per diems gratuitously. It's shameful that a medical center would have per diems work full-time hours for several years and they never get benefits, and the university abuses them dramatically across the state. And contracted out workers is very prevalent in the service unit. You'll find large groups of janitors or food service or even the landscaping people are now contracted out. They actually work for an outside entity, but UC just pays a contract, and it's a way of getting cheap labor and not actually being responsible for the employees, and they just don't do as good a job.
Well, these hospitals are very profitable.
UCSF made $120 million last year and the year before.
No, but they're saying they don't have enough to take care of patients.
UC is completely ignoring our safe staffing and patient safety demands, and they've also are trying to shortchange everything else in the contract. In the contract campaign, we moved more than half of our stuff off the table. We've made major concessions trying to get them to answer to patient care, and they refuse. So hopefully they're hearing the message that we're going to advocate for safe staffing and patient care, and they need to get on board.
Now, have they tried to fire you?
They have not tried to fire me. That would be even more illegal retaliation.
Have any people been fired?
They've been working on trying a very heavy intimidation campaign, just trying to quiet people down and get them to stop talking and feel like they shouldn't talk. But we're a great organized group, and we're going to keep fighting for the patients and students.
When I say union, you say power. Union. Union. When I say union, you say power. Union. Union.
We're out here supporting our AFSCME brothers and sisters in their fight for safe staffing. We all believe they're putting profit above patient care. We're in the business of patient care, so I think they need to make sure there's enough qualified staff members to provide that care, but they seem to think that we're just a big labor cost and that really, they're more interested in profit.
And are they making profit?
Oh, absolutely, they're making profit. They're making a lot of profit. Yes, they've laid off over 300 positions with the AFSCME workers. They've let go our lift team, which was AFSCME. Injuries are up. They know that staff and patients will be injured because we've had a lift team for years. We have trained personnel that come help the nurses with equipment, move patients, turn them, lift them in and out of bed, help them to mobilize, to get up. And they've just let them go. We're the only university medical center that does not have a lift team.
And how have people been injured with that? Why is that a serious health and safety concern?
Staff injuries are up. Nurses, for one, have the highest musculoskeletal injuries. That's going to put any other worker that comes in contact with a patient at risk for injuries.
So this is a serious thing. You're being personally affected.
Absolutely, and it's all in the name of profit.
So you think you're going to be able to stop it?
We sure hope so.
I just thought it was important for for students at the UC to show their support for the workers that make our campus work every day.
Are you concerned about privatization, corporatization of medicine, healthcare in this country?
mean, healthcare should be part of the commons, so I think, yeah, that's definitely a concern for me.
What does that mean, part of the commons?
I mean, I think it's a right that people have a right to healthcare, and it should be available, and also for researchers and folks who make discoveries that, like, the science should be available and free for everybody to benefit from.
Claudia. I work in the blood bank here at Parnassus. And I'm out here. I did the first strike in May, 2 days, and I'm here today because it's not only patient care we're talking about, but it's talking about taking care of our workers who we take care of our patients every single day, and also about the fact that our executives are making $500,000 or more. And I believe that if they really want to save UC for the future, it has to start from the top.
Why do they have this approach to working people, the people that make the hospital work?
I don't know why. I think it's just that they don't prioritize what is important, and because they want to attract top talent and they want to create better opportunities for the top talent, they don't think about the workers who are in touch with the patients every day.
And what is the situation in your local? Do you have a lot of solidarity, or how do people feel?
We do have a lot of solidarity. We have medical students that believe in what we do because we work with doctors every day. What I do, we work with doctors every day. And I think that the top is kind of very out of touch with what we do in reality.
And Napolitano, you think she's going to be any different?
No, I think she's way up there. Quite frankly, I think she's way up there. She makes a lot of money.
How much money does she make?
I think she makes over $500,000, and I know for a fact that her $10,000 rent in Oakland, in the hills, is being paid by the UC system and our students and our salaries. So the 1.5% that I got is it comes to about $20 every 2 paychecks, and it's about 19 cents an hour more. So it's nothing really.
So how do you live in the Bay Area now?
I do. Fortunately, I do live downtown, and I have a condo, and I pay taxes here, and everything is expensive. And I think that if UC doesn't think about it for the future, they're going to lose very good talent where it matters most, and that's the people that work with the patients directly.
Union power! I'm here with some of my classmates from the medical school, just supporting all the great workers who make this such a great medical institution.
So yeah, as a student here, you feel that this is important?
Certainly.
Why is it important?
We want to keep providing the best care for our patients. We need the best workers, and this is an important part of recognizing the contribution they make.
My name is Brenda Barros. I'm the chapter president at San Francisco General Hospital. I'm joining the picket line here today because this is just another battle in the fight against working people that's happening all over the Bay Area. It's happening with public sector workers. It's happening with state, federal, and city workers, of which I am a city worker. And we had propositions put on the ballot to take benefits away from us. It's just an all-out attack on public workers. And I think all unions should be supporting all workers when they're fighting for a decent salary and decent working conditions. Bullying is happening all over the city. I belong to a bullying group where we're trying to get some sort of legislation. We got Campos to put something, proclamation. That was a start. But in my union, on our bargaining, I'm trying to push that we get real reform, and we need to talk to all these supervisors who we support every year, and one of them needs to do something that will really help all workers, like push bullying legislation to make sure that all workers, whether they're public or private, city, state, or federal, who work in San Francisco have safe working conditions. I think BART is just like I said, it's just another battle. It's all a part of, I see it all a part as the same battle. I don't see it as different fights. It's all one fight. A lot of working union people haven't come to that conclusion yet, but more and more people are starting to wake up and see that, when they turn one group against another group, that only helps them. It doesn't help us. It helps the 1%. So all of us need to stick together, and unions have to play a role too. They have to stop doing concessionary bargaining, because that just feeds into this, and the more we concessionary bargain, the worse the attacks become. I say that this is a fight against the Mark Farrows of San Francisco and the Bay Area. We have these so-called Democrats that keep doing things that are totally anti-worker, and the labor movement and the rest of the Democrats who may not not agree with everything they're doing and keep letting these people off the hook. I think there needs to be a concerted, join together, all worker campaign for these politicians who do all these anti-worker things, and I think we need to try to get them out of office, or at least paint the picture so the public sees who the real person is.
And who is Mark Farrell?
Mark Farrell's on the Board of Supervisor. He's the person that pushed Prop A. That's the one that took our rights to bargain for our health care away, and he got away with it. And he had backing of the union, which outrages me that some union leaders back this thing. Most members don't even know it happened to them. But then we had a meeting at our hall yesterday of Pat getting ready for bargaining, and the main person in our union who supported it stood up there and said, we can't bargain for health care. But he didn't tell them why we can't bargain for health care, because they helped to take that damn right away from us. And I am outraged about that.
Why are the union leaders going along with this, some of them? You know,
I think part of the problem is that you have these union leaders, many of them are very high-paid people in their regular jobs. This person is a part of the fire department, so his loyalty is to make sure the fire department is taken care of. I don't think down deep he really gives a damn about the rest of us.
Hey, as the nurses are here, and we know that we can't take care of our patients without AFSCME. We all work here together like family, right, you guys? And we're all one big family. We know more than anybody that having safe staffing levels from AFSCME is absolutely necessary to keep our patients safe. And we're here to stand beside you. We're not going away. We're here to fight for safe staffing for all of us, for our patients, and for retirement with dignity, working conditions with dignity, and we're not going away, you guys. You take on one of us, and you take on all of us.
You know, one thing about AFSCME is that it doesn't matter if it rains or it shines, if sleets or snow, blue skies or gray skies, whatever it is, we will always be there to defend the patients and to take care of the people of the UC system. You guys are awesome. And I just have to tell you that I received a note from UC. And they were saying that, well, you know, if they go on a strike, it's going to do this and it's going to do that. Well, you know, UC, if you want to somehow take care of patients, just settle the issue with AFSCME. Just come to the bargaining table and take care of what AFSCME wants, because what AFSCME wants is what the patient wants, what everybody wants, is to take care of the people. So, you know, it is just so simple to me. It is so easy for me to just understand what this conflict is about. It's about the fat cats continuing to go out there and pay themselves and not take care of the people. And every time, it is about the people and the fat cats. And you know where I'm going to be. I'm going to be with AFSCME. So thank you very, very much.
99.
That's the number of the AFSCME union, 3299. That's the number.
And what's your issues?
What's the issues? Oh, many issues. Discrimination. No pension. Laid off.
I'm a CNA member. I'm Sue Cannon. I'm a registered nurse. I've been a registered nurse for about 16 years. I've been working here at UC San Francisco for about 7 years. I work in the neuro ICU, and it's really important to me that the workers be able to get a fair deal. UC did settle with us, but I'm expecting that UC is going to have to offer now the same kind of agreement with everybody else, and if they don't, they're going to have a big problem with the nurses. That's just my opinion, but that's what I'm willing to do, is give them big trouble.
Why are they taking such a hard line against the unions? Who are these people?
You know, I don't know. It's the sign of the times, right? We've been diminishing unions for years, so that, you know, they used to be 30-40% of the working population. Now we're down to like, I don't know what, 10-12%. So big business has been trying to do that, unfortunately. And the more they basically weaken unions, the more money employers can keep at the top, the less things they have to do to make basically working conditions safe for the workers. And here at the hospital, I mean, we're talking about patient safety things. Not only were the nurses worried about that, but so are the other unions, the RTs, the x-ray techs. I know they have a lot of the similar issues, you know, with wanting to be able to treat their patients to the best that they should. And UC is basically, they don't seem to be a good partner in trying to give patients what we want to give them, the good things that we know patients should be getting as they come here for treatment and care.
And this is one of the best institutions in the world. Why would they threaten the quality and the stature of UCSF? I mean,
why
it seems like it's one of the best in the world.
Yes, why would they? You know, just like I think, would you realize the UC hospitals, there's 5 of them in California, and last year combined, they profited almost $500 million. $500 million. So, you know, there seems to be just something in an employer's mentality that, you know, they need to give the workers less and less and less, and they need to have their bottom line be bigger and bigger and bigger. And, you know, that's just not right. As we see the middle class shrinking, you know, that's the decline of America, really, if we continue to let employers get away with all these takeaways, with cheapening the pension, and not allowing us to have what we need to safely and properly take care of our patients. You know, we're just not going to be the top-notch institution that UC should be, and America is just not going to be the greatest country that we expect it to be. So, you know, my dream is there be more unions. My dream is there's more union power. My dream is employers share the wealth, of which there is an incredible amount, but it's all going to the top 1%.
How long have you worked at UC?
I used to work at UC Irvine, so I've been in the UC system maybe 10 years. Yeah.
It's getting worse.
Yeah. Yeah. And so that's why we got to stand up, fight back. I think that the contract that the nurses got is a template for now all the other unions, and I expect UC to follow that template with all the other unions. And like I say, as far as I'm concerned, if they don't, they have big trouble on their hands.
You should. Treat your workers like you should.
They're messing with the wrong union. They are messing with the wrong workers. I have seen the work that AFSCME has done, and as was said earlier, you know, we just had a major victory when the Department of Public Health tried to contract out services at the dialysis center, tried to move patients, you know, far away from the actual hospital. AFSCME went and testified, and the thing about the testimony that AFSCME presented is that it wasn't about the workers, it was about the patients. Right. And that's what we're talking about today. What AFSCME is ultimately talking about is about patient care. That's right. We are talking about protecting the neediest people. You cannot have patients taken care of if you don't have the right staffing ratios. You cannot take care of patients if you're not taking care of your workers. If the working conditions are not safe, the patients are not going to be safe. That's what we're saying to the UC system. You care about your patients, then do the right thing. Have the right staffing levels. Create a safe working environment to make sure that we make our patients the top priority. That's why we're in this business. And if they don't get it, they're going to have to get it pretty soon, because the entire city of San Francisco is going to be standing with you, with the workers. I'm proud to be here, and let's make them do the right thing.
What do we want? Contract. When do we want it? Now. What do we want? Contract. When do we want it?
Now. UCS, and I'm coming here to support the workers because
because I think the working conditions, they're not good, and the salaries, it's hard for the workers to make a living, but UCA makes so much profits, and it's an excuse that they said the budget cut and everything, but they should treat the workers with dignity and respect and negotiate a contract. Don't take too long.
My name's Anna, and I'm with the food service workers here, and we're trying to negotiate our contract along with PCT's contract for fair wage and retirement and benefits. And it's important to support all the people that work in San Francisco, out of San Francisco, considering that UC gets a lot of benefits from Mission Bay.